These twins have been fighting to see another day after their premature birth at 6 months. Their parents have not lost hope. Every week they bring the twins to Jinja Referral Hospital for assessment.
It's not easy. Sincerely, it's a great work. But if there is that kind of love, yeah.
They have been with us for the past 4 months, coming for regular reviews in the clinic.
The health workers at the Preterm clinic endure long hours to see that they preserve the lives of these twins and other prematures. This clinic runs once a week, on Friday. One of the methods for preserving the lives of these twins is the widely recommended method, the kangaroo mother care, which gives warmth to the infants.
In the chest of the mother, skin to skin, to provide warmth.
According to the World Health Organization, if properly used, kangaroo mother care could save about 450,000 preterm newborns annually.
They named this kangaroo mother care because the man was not involved in doing so. But to me, I call it kangaroo father care because I'm also involved in that.
Moses Waiswa is considered a model father at the Preterm clinic. He turns up each week with his wife in tow, alongside Mercy and Miracle.
If all men would support their wives to this level, it would be outstandingly well enough.
Before, we used to get very many prematures, but the follow-up was not there. So we could not tell how many could survive, how many could pass away.
The Preterm clinic has been very vital in ensuring that these babies, even when they go home, they come back for a follow-up until they reach the necessary weight. Preterm babies and small babies born at full time are mostly below 2 kilograms. The twins were less than 1.
This one was 600 grams and the other one was 700 grams. And we are happy that they have reached 3 kilograms.
At 3 kilograms, they are discharged from the clinic because then they can be as independent as those born full term. Unfortunately, Mercy and Miracle are anemic, one of many complications premature babies get.
We are going to follow them up until 6 months.
Preterm babies do require a lot of attention, and for most, the clinic is chronic.
They have things like cerebral palsy, some of them may have mental retardation, some of them may have visual impairment, hearing impairment.
According to the Lancet Every Newborn series released in May 2014, at least 1.5 million newborn babies survive with long-term disabilities every year. Breast milk, which is food recommended for a newborn for exclusive feeding up to 6 months, is a lifeline for preterms.
These babies, when they are born, they are not mature enough to suckle the adequate amount of breast milk. So whenever they breastfeed, they fall off the breast quickly than the babies who are full terms. So to compensate for their rapid weight gain, we have to give them an additional breast milk. So the mother has to express and give the required amount, which the doctor tells her.
It is a big challenge on the mother on how to manage warmth, to feed and control infection. On the medical side, it ideally should not be difficult. We think the skills and knowledge required to manage these babies can be handled even at lower level health facilities.
Hygiene is required when attending to preterm babies to avoid infections.
We also supplement them with micronutrients like Grovit. Grovit is a high-level minerals and vitamins which we give them.
Nambuya, selfless employee who works tireless to preserve lives, has become a mentor in the region, passing on her skills to midwives who have not gotten the chance to be trained by the Makerere University School of Public Health, which began this initiative. Dr. Tagola, who is the coordinator of the Preterm Clinic initiative that is gradually being introduced to 5 other hospitals, says that initially the target was to care for the most vulnerable prematures.
We are now struggling to ensure that we follow them up because, as you may know, it's not only the time when they are in the facility, but probably when they get home, they are at risk of dying.
Barely a few months after it was established, the Preterm Clinic continues to work miracles as midwives work around the clock.
I think now it's getting on administrative levels. We are getting drugs coming in specifically for children. We think equipment can also come in terms of repair. We think we can improve documentation by creating new indicators related to newborn outcomes and high-risk pregnancies.
it's good because the more you come, the more you learn more things.
If everything was okay, I would desire that I follow up these babies until they are 3 years.
The Heinhorn Family Foundation in Sweden, which started funding this initiative, has since then been joined by DFCU and Save the Children.
Let us together realize our vision of a world where every woman and every child can realize their potential.
Across the world, 2.9 million newborn babies under 4 weeks die each year. Preterm births is the leading cause, accounting for 1 million of these deaths. Preterm is also the second leading cause of death after pneumonia in children under 5 years.
The premature labor is sometimes spontaneous. There's nothing we can do about it. But maybe what I could say is they should seek prompt care and treatment. Some of them, they may have preterm babies, maybe because he had an infection which was not properly managed. The infection can be a urinary tract infection, it can even be malaria per se. If it's not managed well, it can make the mother get a preterm.
Preterm clinics could go a long way in helping Uganda work towards reducing newborn deaths to about 10 out of every 1,000 live births by 2035, a post-2015 UN Millennium Development Goal target. Florence Naluyimba, NTV in Jinja.